segment is sponsored by Intermountain Healthcare and the Utah Department of Health.
All right, if your baby is fussy, drooling, maybe has a low-grade fever, he or she might be teething. Holly Menino explains a few ways parents can help soothe the baby's pain.
An average baby starts getting the first front two lower incisors about 6 months of age.
Before a baby's first tooth comes in, they start teething. This usually begins around the 4-month mark.
What we find is that child can often be a little more irritable. They can have some difficulty sleeping at night.
Dr. Catherine Strasser, a pediatrician at Intermountain Layton Parkway Clinic, says before you assume your child's fussiness is because of teething, double check to make sure it's not something more serious.
What I always want to caution parents about when we're talking about teething is if a child has a true fever and it's 100.4 or higher, that's more likely to be associated with an infection of some sort and not teething.
If your child is teething, there are a number of products that can help.
This is your traditional teething ring that most families are really familiar with. I caution families that they can put these in the refrigerators but not in the freezers.
If you're on the go, a teething necklace for mom is a good option.
These are BPA free. They're a silicone-based hard plastic that the baby can gnaw and chew on, and lots of different sizes and textures on a toy like this feels good for a baby.
If your child needs something more at night, go ahead with the children's Tylenol. But Dr. Strasser recommends staying away from topical numbing gels.
It contains benzocaine, and oftentimes the benzocaine in there can be harmful to small infants. It's not recommended for children under 2.
Holly Menino for 2 News.